As you may well recognize, at present, resection, radiation, and chemotherapy is the mainstay in the treatment of the glioblastoma. And the TMG is the first-line drugs for the GBM. However, it only adds about additional survival for the patient. So this study is want to confirm the safety issues. Please go back. Please go back. Please go back. Yeah. This study want to confirm the safety issues of the repeated BBB opening during the adjuvant the temozolomide therapy. And also we want to confirm the safety issues by undergoing the MRI during the cessation of the adjuvant TMD therapies. And also we want to follow up MR imaging to demonstrate the beneficial effect of this trial. As you may well recognize, the TMG is well penetrated into the brain. However, the concentration of the CSF is only 20% of the plasma concentration. So theoretically, if we can increase the concentration of temozolomide in the brain, there's a chance of the beneficial effect to kill the tumor cell in the brain. Okay, can you go back? Yeah. So I underwent the first cases in the last months, and this patient, we removed the tumors in June of this year, and the diagnosis of GBM. The patient has the methylation positive, 1p19q deletion and the EGFR were negative. And the patient has the conventional radiation therapy with TMG from July to August. Her general condition and neurological status was normal at the time of the BBB opening. This is the preoperative MR images. As you can see, there's a clear enhancing region with the signal changes. And the procedures of the BBB opening is the same as almost same as the regional procedures, but the only difference is we need to give the microbubble. We used the Definity as a microbubble. And we used the lamp option to open the BBB. It is the first detecting the inertial cavitation to see the safety margin. And by iteration of halving the power, we can make a stable cavitation without stop, without making any problems. This is the MR images in the immediate after the BBB opening for during the first adjuvant TMG therapies. For the first in the BBB opening, we only opened the two sites just near the resecting margin. And this is the second target. And this October, we underwent the second BBB opening. And the left side is the MR images before BBB opening with the gadolinium. And this is the immediate after the BBB opening with the gadolinium images. Compared to this in the gadolinium images before BBB opening, you can see the clear enhancing plot in these areas. These are the upper part of the resectable margin. So we open the two sites here. And also we open another one in the bottom of the resective cavity. You can clearly see the enhancing areas in this area. And you cannot see this enhancing part with gadolinium enhancing images just before the BBB opening. And also we underwent the T2 and this one MR images in the immediate after the second BBB opening. As you can see, there's no bleeding or any signal changes in the brain, especially in the areas of the BBB opening. This patient is visiting my clinic because of the feeling of the generalized weakness and drowsiness. And we woke up the patients, and everything were okay. We underwent the thin slice in the CT scan. We didn't see any bleeding or any signal changes. So we conclude the patient complaint as a transient side effect of the TMG therapies, and now the patient condition recovered to normal after completing and finishing the second adjuvant TMG therapies. So as I demonstrated, we just finished the second BBB opening, and the next week we will do the third BBB opening. For this patient, the sixth session of the BBB opening will finish the end of the January, and we will follow the MR scan 1 year after the first BBB opening in the September of the year 2019. So we are trying to recruit 10 patients, thus probably spring of the year 2012, we will see the outcome of our clinical trial. I just want to briefly introduce the laboratory work for BBB opening. We just set up the lab for the BBB opening in rat and mouse, and we published our first paper in this year. And interestingly, we recently submitted several papers. I just want to introduce the one paper we submitted recently. In this trial, we were trying to open the hippocampus bilaterally and also want to deliver the stem cell into the brain. As you see, you can clearly see the BBB opening in either side of the hippocampus. We also confirmed the safety in the BBB opening by the histology like this. And also, another interesting thing is that we found that the stem cell with the focal sound is more than double compared to the control. And we want to apply this technique for the human patient with Alzheimer's disease in near future. And we took these pictures immediately after the first BBB opening. And thank you for your attention.
Other questions? Yes.
I might have missed it. Did you administer the temozolomide according to Stupp or intravenously while opening the blood-brain barrier?
Oh, the temozolomide is usually we are giving by oral intake. It reached the peak plasma dose, plasma concentration within 2 hours, usually 1 or 2 hours. So we just opened the BBB. We are giving the drugs in the MR room after just open the BBB. So it's not difficult to give the medication during the procedures.
Is there another question?
Yes, very nice talk. Just a quick question about your stem cells. What kind were they? And were they, I mean, you were actually getting them in without the focused ultrasound treatment?
Yeah, I think it's kind of the animal experiment. If you just use rat mesenchymal stem cell, stem cell can enter the brain without offering the BBB. However, if we combine the focused sound, the number of stem cells in the brain can be triple or sometimes more than triple. So I believe if we combine these two techniques, maybe we will have the beneficial effect with the stem cell. So I think this is the feeling, but we don't know which type of stem cell will be the best to apply in human.
Okay, and these were administered immediately after the blood-brain barrier opening, not before?
Maybe. I don't know at this moment. Yeah.
Thank you. We have one last question. Okay, we'll proceed to the next. We're very delighted to have